great way for us to connect the right startups with the right clinicians in an American hospital system, and actually having somebody who's willing to listen and meet and introduce people. This is my first time in Texas. It's been fantastic to actually meet the people, to seeing them here and seeing the hospital systems and getting a feel, first of all, how big it really is, but also about the real potential for the Danish companies. We can see that there's a sincere interest actually to meet some fantastic startups, and we want to use that. And we've already seen how startups have engaged with some of the clinicians here, and I think that looks very promising. Healthcare has significant challenges in the US alone, but also in Europe and across the world. What excites me the most is basically that digital solutions is part of the solution. We will not be able to solve the challenges in healthcare without having more digital solutions, more treatment at home, more fantastic solutions for the people who really need it.
There are many benefits with BioBridge, but I think one of the things that I really love about this initiative is the trust there is between the people from the Texas area and from Denmark, meaning that knowledge sharing is on an extremely high level. There's a high honesty in regard to not only the wins, but also the difficulties that we see in the health tech and the health sector. We need those places where we can go in and talk to clinicians and to decision makers, where we can learn about the different reimbursement models, different ways to tap into the patients, and also to make sure that our value proposition is fitting in the US context. Because even though that we are doing okay in Denmark and have a value proposition that people understand in the public healthcare sector, this is so different. We need to go places and ask those questions and get those learnings in before we make the final decision of what to do in the US.
For Coloplast, we are continually looking how to better partner with US medical institutions. We really want to understand who are the healthcare professionals that are truly moving the needle in terms of healthcare. And the TMC is enabling us to know who in the US, especially in Texas, could those partners be. We've seen a number of things that span a wide breadth of information, all the way from infectious disease up to surgical suites. What it's showing us is there are real opportunities for innovation, and it's giving me new ideas to send back to headquarters, which is so exciting. It's a new way for the US to influence innovation in Denmark. The future of healthcare, I feel, is really going to be driven by innovation as well as data and use of data. This really is enabling us to understand how are the different healthcare systems moving, what is changing in Denmark, what is changing in the US, and how can we actually glean the best from both healthcare systems to make the maximally best